Are you suffering from severe knee pain and severe arthritis? Have you been advised for a knee replacement surgery? Let us burst certain common myths and misconceptions about knee replacement surgery today. Myth number 1. Knee replacement surgery is very painful, post-operative pain is very high. But the fact is, knee replacement surgery has become very less painful now. At the time of surgery, you will be giving spinal anesthesia, that is anesthesia to your spine, and entire lower half of your body is numb so that you won't be able to feel any pain during the surgery. Even after the surgery, what we give is called multimodal pain control. That is, we give a local painkiller injection around your knee, as well as painkiller injections to your spine, which we call epidural anesthesia, as well as nowadays what we do is called patient controlled analgesia. There is a small button which is present in your hands, which you press when you experience pain, so that the painkiller drug will be released in small quantities, which reduces your pain very much. Myth number 2. Knee replacement is very risky surgery. There is a lot of complications. But the fact is, like any other orthopedic surgery, knee surgery has minimal complications of around 1 to 2%. There is no additional risk or additional complications in a knee replacement surgery. With proper OT staff, OT techniques, and in a proper hospital like ours, the complication rate is quite less, almost I can tell less than 0.5% in a well-equipped hospital. Most of the times the complications are very minimal, like infections, sometimes blood clots in your veins, which will be very much prevented, which can be very much treated if they arise. Myth number 3. I need to be on prolonged bed rest after knee replacement surgery. The fact is, this is completely false. After the knee replacement surgery, you will be able to walk within 24 hours. You will be able to walk with the help of a walker for a few weeks. Afterwards, you will be able to walk with the help of a walking stick. Within a month, you will be able to walk without any support. Most of our knee replacement patients will be able to walk comfortably, climb stairs, do everything within a couple of months. Myth number 4. Knee replacement implant is a foreign body which causes reactions in your body. The fact is, the metal which we use in knee replacement implant is made up of either cobalt, chromium or titanium. Nowadays, the latest one is oxynium. All these metals are very much biocompatible. That means your body accepts it very well. There are very less reactions. There is very less biocompatibility issue with these knee replacement implants. Myth number 5. My knee replacement surgery will last only for very few years. But that's absolutely false. With the latest implant technology which is available, the modern day implants have a longer life of almost 20 to 25 years. That means for most of our patients, a knee replacement surgery generally lasts for lifelong. Myth number 6. There is a lot of physiotherapy which I need to do after knee replacement surgery. But the fact is, like any other orthopedic surgery, physiotherapy is must and part and parcel of our healthy recovery. There is no need of any prolonged physiotherapy. There will be post-operative physiotherapy in the hospital for a few days, followed by a few weeks of home physiotherapy, which you will be able to do comfortably at your home. It is not vigorous physiotherapy, simple exercises which you can do at your home so that you can recover quicker and faster. Myth number 7. I won't be able to bend my knee after knee replacement, then my knee will become stiff. I won't be able to climb stairs. I won't be able to drive after knee replacement surgery. But this is absolutely false. The fact is, you will be able to bend completely, almost more than 100-110 degree after knee replacement surgery, up to 120 degrees. And because the latest implant designs allow you to bend your knee fully so that you can comfortably squat even after knee replacement surgery. And climbing stairs won't be an issue at all. You will be able to walk within 24 hours after knee replacement surgery. You will be able to drive comfortably within a month of knee replacement surgery. Myth number 8. I have diabetes and I have high blood pressure. Am I fit for knee replacement surgery? Yes, absolutely. In fact, diabetes and high blood pressure are not a contraindications for knee replacement surgery. Only prerequisite is your blood pressure and sugars must be under control before we start a knee replacement surgery. Either way, we have good medication to keep your blood pressure and diabetes very much under control at the time of surgery and even after the surgery. Myth number 9. I am already old, I am 70 years old. Can I proceed for a knee replacement surgery? Yes, definitely you can proceed. Knee replacement surgery is generally advised for age-related osteoarthritis only after the age of 55-60 years. So it can proceed comfortably for a knee replacement surgery any age between 60 years to 80 years. And the last myth, knee replacement is just like liver transplant or kidney transplant. They will remove my entire knee and put a new knee. But that's absolutely false. Knee replacement is essentially just a surface replacement. What we do is replace the damaged surface of the knee joint. Your native knee joint is always there, your native bone is very much preserved. We remove only 8 to 9 mm thickness of the damaged bone and replace it with new metal, giving you a new joint. Thank you.